Hello there everyone, this is 5 Minutes Medicine, and today we will talk about another communicable disease which is knocking our doors after COVID-19, that is the monkeypox. But what is it? Simply speaking, monkeypox is an infectious disease caused by monkeypox virus. But there are some questions which we need to know about this disease, which are: how does it spread? What are the signs and symptoms? What are the tests for diagnosis? And what are the preventive measures and treatment regimes for this disease? So let's start a discussion by knowing some things about this virus. Monkeypox virus belongs to Poxviridae family, same as that of smallpox, but thankfully this virus is a lot less dangerous than its relative. The disease caused by this virus is by viral zoonosis. That is, it spreads to humans from animals. Though the origin of infection is still not known, it is believed that the virus came from an infected rodent. Monkeypox can be caused through bites or scratches of infected animal, or by consuming their meat. From humans, it can spread through direct contact, exchange of fluids, and blood, and of course the respiratory droplets as well. As for the signs and symptoms, early symptoms involve non-specific ones like headache, weakness, fever, etc. Along with fever, swelling of lymph nodes can be seen on neck, axilla, and groin region. These swollen lymph nodes are an excellent differentiating factor from smallpox and chickenpox, as both these diseases don't exhibit this symptom. Around third day of onset of fever, peculiar rashes start to develop on the skin, which are mild and looks like dots in the beginning, but later develops into pus-filled ulcers. Although in most cases, these lesions wear off on their own after 3 weeks of onset of disease. Primary diagnosis of monkeypox is based on physical examination and history taking of the patient. Tests like complete blood count, urine analysis can be done for provisional diagnosis. And for the sake of confirmational diagnosis, tests like PCR, tissue biopsy can be done. As per guided by CDC, any physical contact or contact with materials of sick animals should be avoided as a preventive measure. Isolate the infected person to prevent furthermore proliferation of the disease. Maintain personal hygiene. And although the studies are done on limited people, smallpox vaccine has shown a remarkable effect against this virus, with efficacy reaching up to 85%. Apart from prevention, medications like antivirals could be used for those who are suffering from this disease. Broad-spectrum antibiotics can be used for preventing any superimposed infection. IV immunoglobulins, plasmapheresis can be done too in viral phase of this disease. And symptomatic treatment can be done involving analgesics, antipyretics, and supplemental oxygen. Now the big question, will it cause a global lockdown? For this we should keep an account that we've had similar outbreaks of this disease in the past, and we have learned from our past experiences that this disease has very low mortality rate, with the last outbreak causing 0 death. And this disease is self-limiting, that is, the symptoms wear off after 21 days of onset of this disease. So let's hope for the best and keep our fingers crossed. So that's it for today. If you liked the video and found it helpful as well as informative, please help the channel to grow by liking, sharing, and subscribing it. Thank you. See you until next time.